So, before we get to content, I have a few housekeeping points. So the first thing is that this event is not run according to Chatham House rules, and it will be on the record, so note that. If the fire alarm sounds, it won't be a drill, it will be for real, so please everyone should make their way around out through the doors to the ODI reception. And copies of the reports are on the table outside and on the stands in the reception area, so please do help yourself. They're also available to download from the OWLNAP website. And to tweet this meeting, the hashtag is on the slide up there. Is it?
Yes, it is, just at the bottom.
Very good.
Evidence crisis. #evidence crisis.
Perfect, thank you. And could I ask you now, please, could you either turn off your mobile phones or to put them onto silent? Thank you. Okay, let's get going. So what's significant about this OWLNAP study? Well, as many of you will know, OWLNAP has an evaluation focus, and our focus on this issue of evidence in the past has mainly been about improving evaluation concepts and evaluation methods. And over the past 15 years or so, we've grown an evaluative reports database, which now has about 1,000 evaluative reports. And I think they represent a key element of the humanitarian knowledge bank. And we also monitor the quality of these reports, and so we know there's room for improvement. But of course, a strong evidence base requires more than just evaluative knowledge. And for this study, we've broadened our approach and we've looked at different areas of humanitarian action: early warning, needs assessment, programming, etc. And we've also drawn from other disciplines, from health, from natural sciences and from social sciences. And I know that Paul has been helped by a very diverse range of academics, practitioners and researchers who helped him put this report together. And I think the report that we do have, as far as I'm aware, is probably the most comprehensive analysis on evidence in the humanitarian system that I'm aware of. So I think it will be an important contribution to making humanitarian action more evidence-based in the future. So before we get to the report itself, let me introduce you to our two panelists. Just further down on my left there is Dr. Joanna McRae, who is the Humanitarian Head of Profession and Senior Researcher Advisor at DFID. She recently led the development of DFID's strategy for humanitarian research and innovation. She joined DFID in 2005 when she worked as a humanitarian advisor, leading major elements of DFID's humanitarian reform agenda. And she went on to work in its research division. Prior to DFID, she spent 10 years here at the Overseas Development Institute, where she wrote extensively on international humanitarian policy and led the ODI's Humanitarian Policy Group. She's author of Aiding Recovery, The Crisis of Aid in Chronic Political Emergencies, and she's also former co-editor of Disasters and is now a member of its editorial board. So welcome back. And sitting next to me is Dr. John Seaman. Now, John is a co-founder of Evidence for Development, and he has, as many of you will know, an international reputation as a leading practitioner in operational research in emergencies and the economics of poverty. In 1992, John initiated the household food economy approach, a groundbreaking methodology for famine prediction and vulnerability assessment. From 1979 to 1997, he was head of policy development at Save the Children UK, where he was responsible for health, HIV, education, nutrition, disability and social policy. And from 1998 to 2004, he was Save's research director for the Food Security and Livelihood Unit. Now, John qualified in medicine from the London Hospital in 1971 and began his career in emergencies in Biafra, it's a long time ago, Bangladesh, Ethiopia and the Sahel during the 1970s. He was the first editor, in fact the co-founder and first editor of the journal Disasters, and he's written a variety of field manuals for WHO, UNHCR and PAHO. He's also been a member of the board of the London School of Hygiene and Tropical Medicine a member of the British Council Health Advisory Committee, nutrition advisor to the Overseas Development Administration, member of the MRC Tropical Medicine Research Board, and honorary senior lecturer in the Department of Human Nutrition at the London School of Hygiene and Tropical Medicine. From 1998 to 2004, he was research director of the Food Security and Livelihoods Unit at Save the Children UK. He's currently a visiting lecturer at King's College London, and not surprisingly, he was awarded the OBE in 1996. Just to add, that John probably won't remember this, but reading out your CV there, I was fortunate enough to be one of the lucky students in the nutrition department in 1993 at the London School of Hygiene and Tropical Medicine who benefited from your lectures back then. In fact, I do remember that many of the students, myself included, always used to look forward to your lectures because at the time they were very, very practical. And I do remember one in particular where you were telling us how to make porridge for supplementary feeding using an old oil drum and 3 stones and some branches that you'd found in the bush to use to stir the porridge. Of course, it's all plumping up nowadays, John, so that's all gone. But lovely to have you here with us. So we're going to hear from Joe and John later, but now we'll turn to Paul Knox-Clark, who's the Head of Research and Communications in ALNAP, and Paul is going to present the report to us now, I think.